Epidemiology is the core foundation of public health. It's kind of the science of what public health is built on. So an epidemiologist is not a doctor, but it is a highly trained professional. They're the investigators looking for things that are happening in communities that might be impacting health and well-being, and then looking at the data to figure out who's most impacted so that we can try to make a difference more quickly and more effectively. I think the COVID pandemic really highlights why an epidemiologist is so important at the local, state, and federal level. We have to have epidemiologists with this special training on staff to be able to look at all the data and help us achieve that. We've been able to demonstrate through a real-life, unfortunate pandemic why we need epidemiology as part of health departments. They can find things quicker, faster, because they're looking for it. And so sometimes we can get a step out in front of a big problem and stop it from becoming a big problem. We have had the epidemiologists on board here at CHA for about 6 to 8 months because we were able to use the COVID funding. By having the county also now provide the funding to continue the position, we'll be able to continue to do this good work and not have to worry about where the funding will come from. Our epidemiologist has been almost exclusively focused on COVID. One of the main things to work on in the first 90 days is really starting to dig into what subpopulation groups are most affected by certain health conditions so that we really understand from an equity perspective who's most likely to be suffering from the diseases we're seeing so that we can then target our outreach and intervention efforts at reaching the people most impacted by disease.